I have kind of a rare form of leukemia.
I was diagnosed in September with breast cancer.
I have multiple myeloma.
I had a cancer of ampulovator, they call it.
In March of this year, I was diagnosed with ovarian cancer.
Emotionally, I was still struggling with everything that was happening to me.
Everywhere I went, it was cancer. But I wanted to do something good for me.
I was a runner before this, so I was running 5K races. So being out of condition, I was looking for somewhere where I could start running and build myself back up again.
All at the same time, I need something that they can understand my limitations, things that I can't do.
There is growing evidence that exercise is important for cancer patients.
The evidence is pretty compelling that that women who gain weight following chemotherapy have a worse outcome.
If we thought about exercise as a pill and it was easy to take, it is so safe and effective that virtually everybody would be prescribed exercise. So they're working fairly hard.
Health practitioners in the Hamilton area noticed that once cancer patients had completed the acute phase of treatment, there was a gap in care.
We can only work with people who are inpatients, and when it came time for those folks to leave the hospital, there wasn't anything available in the community for them to keep exercising.
We've had an interest in looking at what the needs for cancer patients would be beyond the active treatment time frame for some time.
That interest translated into the development of CanWell, a community-based exercise and education program designed for cancer patients at any stage of treatment. The project is part of a broader vision of delivering health-related services at a community level. CanWell was developed through a community health partnership between the YMCA, Hamilton Health Sciences, McMaster University, and the Jurvinski Cancer Centre, with funding from HealthForce Ontario, a division of the Ontario Ministry of Health and Long-Term Care.
When people come to the Y as a CanWell participant, they have the approval of their healthcare provider. They go through an intake where we look at their experience with cancer and also any other health problems that they might have.
We do a medical review, and the goal of that review is really not necessarily to know about their medical problem, it's more to identify safety guidelines for exercise.
They get connected with a kinesiologist here at the Y, and an individual program of exercise is prescribed for them.
The CanWell team works with each participant to develop a program best suited to them.
We know if people do exercises that they don't like, they won't exercise. So it can range treadmill, pool exercise, walking, weights, yoga. Everything is game as long as they know how to do it safely and they work at a level that will improve their fitness.
CanWell, like all YMCA programs, is open to anyone in the community.
We're not going to turn anyone away at the Y due to financial circumstances, so we offer financial assistance. Our most important goal is getting people in and getting them active.
Creating a safe workout environment for participants was the program's first priority.
It became clear that one of the things we had to do was to create a training education program for the staff at the Y, and the particular things that they needed to be aware of in making sure that they would be able to help people exercise safely.
The Y staff would be YMCA certified, so they're certified fitness leaders. This is an enhanced training to that, and we've also got the health professional expertise on site to help support that learning.
Using the safety guidelines, then we can decide or prescribe an exercise program that is based on the research in terms of what we know works best for people with cancer.
I have limitations on how much weight I can bear because my bones are so fragile. I was a little bit hesitant.
I had surgery on the left breast, and so they told me we were going to work on strengthening that arm.
I think that the most important thing about CanWell is the fact that we're dealing with specialists here who understand oncology patients and understand their needs. So for oncology patients, it's a very, very safe place.
The CanWell program is 12 weeks in length and involves 2 supervised and 1 unsupervised exercise session each week. Participants are monitored throughout the program.
Some measurements we do every single time they walk into the facility to do a workout during the supervised exercise times, and some we do at the first week, 6-week, and 12-week time frames of the program.
The other part of the program is education for the participants So we've run sessions on how to exercise safely, nutrition, how to get better sleep.
The education sessions were very helpful, and the one thing that I really liked about it is they would actually come to the group and ask us what it is that we wanted to learn more about.
Through common exercise times and information sessions, the program has encouraged peer support.
Oh, I think it's absolutely wonderful that we can support
We've
each
structured
other.
it that way so that there will always be peers, other people with cancer here exercising along with them.
Most of the people do need support and they want to know what others went through.
When you feel down, you talk to somebody and they kind of encourage you to go on. You don't feel out of place.
The CanWell program has generated very positive feedback. Almost all program graduates are continuing their exercise program.
But when the program finished, I said, there's no way I'm going to stop this ever.
It was very worth every minute that I've come down here.
Sometimes in cancer you get very depressed, and the workout itself is great. You have a great shower and you feel like a different person all over again.
I feel great. I just feel great. I love coming here.
Physical, I'm stronger. I have more stamina. I've just seen myself feel stronger and better about myself.
It not only makes me feel better physically, but it also helps me mentally and spiritually and every which way.
It's made me feel really good about myself. I come here and I get energized and I just feel good, really good.
As a researcher, we say, well, that's all very nice, but if they're coming out and working out, is there any physical benefit? Are they actually improving?
Well, we have taken a variety of different measures as part of the pilot program, looking at walking speed, strength test, functional tests.
Even though it was 30 patients, we're seeing statistically significant changes, and they're clinically meaningful to the patients and their families.
We've seen people getting stronger. We've seen people being able to exercise for longer, so more endurance.
When the participants tell us that now they can sleep first time in 3 years, it's harder to measure, but for me, it's more important.
Patients who actually feel happy because they feel that they're doing something for themselves, who are going back to work, who are feeling good about the way they look, about their stamina. And as far as I'm concerned, for me, that's a hard outcome.
While CanWell has been very well received, what about the program's future?
We've seen a tremendous interest from people in the community. This has something to offer to all communities.
I think it needs to be nationwide. We've started here. I think it's a very successful model. The patients love it, the oncologists love it. Everybody working in the model is excited about the positive environment.
I think that it's really an important program. Cancer is a chronic disease now. There's so many people living with cancer. There's so many young people developing cancer, and we have to continue to live well.
Programs like this encourage patients to think ahead and to live, rather than to spend their lives as cancer patients. And I think that's tremendously important.
I loved my life. I had the world's best life before this, and it's time to get it back. And this is part of what gets it back.